Saidi Nsamba is my name. I also do coordinate mental health and sexual support in the education sector at the Ministry of Education from pre-primary to university. Somebody running through my slide, you just help me to run to the next one. I captured some visual aspects for the teachers and learners to keep reflecting on. On that next slide, before I go into learners and mental health in schools, I want you to reflect. These are products of some schools within Uganda. In the first image or illustration, that is the product. For teachers, these are the learners you are producing out. For the learners, maybe that is how you will get out of school. When you critically look at it, it definitely tells you that there is a challenge, because in that school they are building more the head as opposed to other body parts. And definitely by the time you will get out of school, you will be deformed. It is not a good one. I will not mention which school is that. In the second image, the first image is emphasizing more academics. They think life is made up of only academic work, and that's what you go with. It's not a good one, and it affects your mental well-being. In the second image, we are talking about schools that are emphasizing, they pretend to be vocational somehow, and they are building more the hands than other body parts. The learner can't do anything on their own. The third image in the next slide is where they claim to be more spiritual. So they build the heart, and other body parts are left really in need, and still you will be deformed. The fourth one is what we really wish to see, that the school is addressing the mental or the cognitive development of the child, the affective domain, and the psychomotor. We have very few schools in Uganda that are doing that, though the lower secondary curriculum is trying to address those aspects. I'm trying to run through. In the next slide, as we are here, as we deal with young people as schools, as education sector, that hand of right is very critical to us. There could be 1,001 rights of young people, and some people don't want to hear them, but these 5 nobody has challenged us on them. The first one is the right to education, so long as you are below 18, and that's why we have a number of government interventions to address that. The second one is protection. If you're a runner, if you're a student, if you're a child, you should be protected at school from abuse and all other forms, which is even emotional. Along the way, and even as long as you are in the school uniform, it is the duty of the school staff or the teachers to ensure that. The third one is participation, as you are doing. The fourth one is right to play. The fifth one is what has brought us, the right to health and well-being. All of our efforts go to waste if we don't invest in our health and well-being. And the mental health is equal as important as the physical health of the body. In the next slide, it just tries to summarize our understanding. Of course, a number of issues, as you have already heard, have come up. Substance use, pregnancy, gender-based violence. All of these ones do affect the mental well-being of young people. But also, critical to note, Dr. Basanga must have told you earlier, is that mental health challenges begin at an early age, and normally your stage is more prone to these issues. And all this will affect your learning outcomes, as we are likely to see. In the next slide, I was just trying to summarize the different mental faculties and the number of mental disorders in Uganda, which I will not go into the details. In the next slide, because I have 10 minutes, There are increasing cases of mental health challenges, and the COVID just exposed a lot of our nakedness. And as the education sector, we are realizing there are many gaps in the provision of mental health needs of younger people from the school level to the national level. And as a result, I just want also in the next slide, just to reflect on this. These are a number of issues that are there: drugs and substance use, academic fatigue, the child mothers, child labor, absentee parents, suicide, the disease outbreaks, and so on and so forth. All of these are issues that are bogging down both the teachers and the runners. In summary, in the next slide, we have a number of mental well-being challenges, including the post-stress disorders, the depression, anxiety, self-harm, alcohol and substance use, bullying. Violence is directly related to mental challenges, and the attention hyperactive disorders. In the next slide, I just tried to capture the cycle of addiction. Many people have talked and many are continuing to talk. When you enter the issue of when you get addicted to drugs, it is not something that you can easily get away from. It normally begins by trying to test, feeling good, and the other issues will come up. In the next slide, because of time, those are some of the impacts directly on the learning outcomes: school dropouts, poor academic performance, pregnancies, and so on. One would wonder, because somebody asked Dr. Basangwa the relationship between drug use and the infertility. And here we are talking about pregnancy. Of course, when you are using drugs, it tends to compromise your reasoning and your skills or making effective decisions. In the next slide, it is also on the effects. Drugs will affect almost all your body parts. So you go in knowing that you are cutting your survival by a number of things. You are impairing your body organs. And in the next slide, as I try to run through, we are looking at the relationship between mental health and learning outcomes, and there are many, ranging from compromising your engagement in academic work, affecting your learning attention, affecting your classroom concentration, and affecting your progression. All of these are effects we can't do away with at the moment we compromise our mental health. In the next slide, we are looking at some of the few things that can enhance our mental well-being. Physical activity is one of them. I came in when some of you were here trying to demonstrate. But physical activity is one of the things that can occupy your mind. Talking to someone is also another one. And you having skills of resisting, especially peer pressure, not to touch or to test, will be a good one. In the next slide, how do we ensure that we support our peers through the mental health challenges? I talked about a number of things, including working closely with those that can support, facilitating psychosocial support, providing what you can as leaders, identifying those that need support or they are having challenges, and you keeping informed as leaders. You must be at the top of your game. Otherwise, there will be no difference between you and other people. In the next one, it is also emphasizing support, including listening, comfort, and reassuring those that are challenged, because it is either you exposing them or you supporting them to come out of the drug addiction. In the next slide, I was talking about the specific roles of student leaders, including advocacy for mental well-being, lobbying for activities that enhance, including games, identification of peers that can be so significant, even if they are not leaders, the drug and substance use campaigns, like this one we are doing. I will be very happy if you organized in your respective schools, for example, campaigns or debates or something of the sort around the drugs to ensure that even the community is brought on board. The peer support network, one of the facilitators talked about it. Dr. Kibenge, PSC Gender, talked about it. Your peers understand you more. Therefore, if you have a challenge, they can support you more. And if they have a challenge, you are the best person to support them the more. Clubs, government is deliberately doing all it takes to ensure that clubs are active in schools, because it's one way of engaging the young people. Life skills and you being ambassadors. We are also in the next slide. You are moving faster than me maybe. The next slide, we are talking about the roles. We are talking about ensuring a safe and supportive school environment is great. One of your core roles, and as student leaders, that is your cardinal responsibility that you should focus on each day. We are also talking about review of positive school culture. Some of the school cultures are demeaning, they are emotionally traumatizing, and we need to ensure that these are revised. Safety, I talked about it, but also the issue of violence and harassment is directly linked to emotional and mental breakdown. And then ensuring that there are mechanisms of providing feedback, either to the administration or you as student leaders. In the next slide, I was just trying to summarize the different linkages where you can get support. It can be from peers, it can be from elders, it can be from hospitals. I also talked about the Saudi. In the next one, I'm trying to ensure that I'm within the 10 minutes. In the next one, the Minister of Education, Dr. Afsa, talked about the mental health circular. There are many things that are provided for in this circular, but one of them is that your school, if it is worth being called a school, then each week there must be 1 hour dedicated to mental well-being of both teachers or staff and learners. Even if they just go and sit under a tree, under a shade, and they do self-reflection. We are talking about the mental health hour because people are overwhelmed by academic pressure and other issues. They can't reflect on the life they want to live. We have started, some of you will be consulted. We are developing guidelines on the provision of mental health in the education sector, working closely with the Butabika Hospital and Makerere School of Public Health. We want to ensure that this is done. We are also developing a harmonized training manual for mental well-being, so that whoever is going in schools or education institutions, they must be using the same information. We are also in the final stages of developing learners' booklets. They are just waiting the approval. We have booklets on maintaining your mental health for both primary and secondary or post-primary, and booklets on drug prevention for both primary and post-primary. We just concluded that last week. And also the other one is strengthening school health. Dr. Chibenge equally talked about it, rather school family initiative. And in this case, family means something unique to us. When you talk of family, F is, we are talking about support. The other one, each one of them means something when we are in the packet. We are also developing capacity of teachers, because these are non-clinicians and most of them are not psychologists. We are also strengthening peer-led approaches. We have guidelines on clubs, and then routine support supervision to schools. Ladies and gentlemen, in the next slide, just join me to give flowers those different partners that have really closely worked with the Ministry of Education to ensure that mental well-being of learners and staff is enhanced. Flowers to Ministry of Health, flowers to UNESCO. Rosemary, we are very proud of you. You are very good partners. Flowers to Asante. Asante Africa should be here. Flowers to Butabika Hospital. And flowers to Drugs Apana for convening arts. This is the third time they are doing so. And flowers to Community Concerns Uganda. And Peace Uganda, we are all very proud of you. Thank you very much. We feel that we need to take this information here and beyond. We cascade, then we will have meaning to our communities. Ladies and gentlemen, I have used 9.5 minutes. Thank you very much.